We're going to be discussing the bones of the forearm, and similar to what you have in the leg, you're going to have a medial and lateral bone, which during supination, they're going to be parallel to one another. So we're going to start by talking about the more medial of the forearm bones, and that is the ulna. The ulna is going to be longer than the radius. It's also really the stabilizing bone of the forearm, and it has mostly to do with this proximal end of the ulna. And as you can see, and I'm going to turn this to a lateral view here, that the proximal end of the ulna is going to be quite a bit more complex than what you have in terms of the distal end. The proximal end is going to articulate with the humerus, and this is what's forming that true elbow joint right here. So the most proximally projecting portion of the ulna is referred to as the olecranon. Sometimes you see in textbooks olecranon fossa. This is really forming that point of the elbow. And if you look at a posterior view of the olecranon, you have a mounding or building up of bone, because this is an attachment site for the large triceps brachii muscle. So when you have elbow extension, this olecranon really engages in the olecranon fossa on the posterior side of the humerus. Now the smooth articular surface right here, in this crescent shape that you can really see in this lateral view, is referred to as the trochlear notch. And this is what's articulating with the trochlea of the humerus. And it really fits in well there and limits the side-to-side movement and allows the flexion and extension that can occur in the hinge joint of the elbow. Now on the lateral surface, right here, you'll have another articular surface, and this is your radial notch. This is where you're going to have articulation with the radial head. So just distal to that trochlear notch. Now during life, the radial head is going to be completely encircled by the annular ligament, which will also attach here at the radial notch. So this is forming that proximal radial ulnar joint. Now as we move distally in the ulna, you have the much less complex nondescript head. So small and rounded. You have a styloid process here that's projecting distally. And this area can be actually palpated on the posterior side. Okay, so now we're going to move on to the lateral bone, the radius. I'm going to show a better view now, so a more proximal view of the head of the radius, because it's quite distinct. You can see that it's concave here for articulation with the capitulum of the humerus, and that is going to fit, remember, into the radial notch of the ulna. Now just distal to the neck of the radius, you're going to have another tuberosity, so more anterior-medially, so facing towards the ulna. This is referred to as the radial tuberosity, and this is going to be the attachment point for the biceps brachii. Now, the more complex part of the radius is going to be in the distal end, and as you can see, it's quite a bit wider in this area. You have this whole smooth area or articular surface, which is going to articulate with the proximal row of carpal bones. So the radiocarpal joint will be formed in this area. The distal end is a common site for fracture. Often you can have a complete transverse fracture of this distal 2 centimeters of the radius. This is referred to as a Colloid fracture, and is a fairly frequent type of fracture. What will happen is this distal fragment is generally displaced dorsally, and it's often comminuted, meaning the bone can actually shatter in this region. And this can occur as a result of a fall by outstretching the upper limb. The last thing I want you to note is the styloid process of the radius. So this is going to be the distalmost projection. You actually have the attachment for the brachioradialis muscle here, and this is going to be much larger and extending more distally than the styloid process of the ulna. And this is very important clinically, because when you do have a fracture here of this distal end, that can change the position of the styloid process.